Hi, everybody. I'm Kara Sundlin, and thank you for streaming with us on WFSB Plus. We're talking about something that's so important, and that is the federal changes to the children's vaccine recommendations. And I am joined, actually, by the head of pediatric in immunology and infectious diseases at Connecticut Children's, and we have Dr. Ian Mishla. Thank you so much for being with us, Doctor. We really appreciate. I know so many parents are confused, so we appreciate you lending your time to us.
Thanks, Kara. I really appreciate the invitation, and I'm happy to spend time explaining some of these confusing things that people may find not really easily understandable. So thanks very much.
Yeah. First of all, let's just talk about what's changed, because there is new CDC vaccine guidance for children now. So the next time you go to the pediatrician and they talk about, oh, it's time to get such and such shot, it might seem a little different. Can you tell us what's changed?
Yeah, certainly some of the things have not changed, and that's what's important to remember. Access to immunizations has not changed. Anybody can get access and get vaccines for the children for all the same vaccines that they did before, but the recommendations have changed. This is coming from the CDC, whereas the states themselves make the final decisions about what vaccines are recommended and needed to enter school. So what's changed right now is the CDC has divided their recommendation to three parts. The first part is the immunizations that are recommended still for all children. And there's a few of those. We can go through those a little bit. The second group are the children who they recommend vaccines for who had high risk for developing either severe disease or just greater risk for developing those infections in the first place. And then the
Okay.
third group are those vaccines where the recommendation is just to discuss with your healthcare provider to decide if that's appropriate for your child based on what the risks and benefits are for your child.
Because there has been so much confusion, and here in Connecticut, you mentioned some regional or state by state advice. Is what we're saying at Connecticut Children's different than what the CDC has handed down?
So Connecticut Children's follows the medical community advice. In the past, we always followed the CDC recommendations. These would be evaluated each year by a scientific and medical committee called the Advisory Committee for Immunization Practices. They would make the recommendations to the CDC. Unfortunately, what's happened now is that has been disrupted, and now the CDC directors have come out with new schedules which haven't gone through that scientific process of where the advisory committee gives advice. And in the past, we'd not only follow the CDC criteria, but we'd also look at what the American Academy of Pediatrics recommends, which often would align. In fact, I think in all cases, it would align. What's happening now is with the change in the schedule recommended by the CDC, that's now at odds with the recommendations that are coming out of the American Academy of Pediatrics. And so at the end of the day, as you said, each state will make their own recommendations, and that's what we living in Connecticut will want to follow. There's school entry requirements, but as a whole, as a medical practitioner speaking for myself, I would want to do, based on the science that I'm aware of and the research studies, follow the recommendations that we've always had because they are based on good science and good evidence. And all vaccines for all children need to be discussed with their parents. We always have to inform them, get their permission to go ahead and vaccinate the child, and make sure that they really understand what are the risks and benefits. And no medication or vaccines without any risks at all, but most of them are very mild risks. So it's that discussion, which I think is what Connecticut Children's is really emphasizing. There needs to be discussion. We need to respect parents' views and thoughts and meet them where they're at and educate them about what the facts are about the scientific evidence for why we've always given these vaccines. The safety of the vaccines hasn't changed, but the recommendations coming from the CDC has changed.
Yes. And there's certainly, we all hear about more vaccine hesitancy. Perhaps when I was growing up, you just got your shots. There wasn't a lot of talk about it. Now we have groups certainly that have protested at Connecticut. They don't want to have vaccines in schools. We had Robert F. Kennedy Jr. say that he was likely going to make some changes, and that has happened. So I'm curious, what kind of concerns, if any, are you hearing from parents who are just dealing with their busy lives and want to do the best for their children? So when they come to you, is there concern and more questions? And what are you advising? What are you saying to them?
Yeah, these changes have just come online. As you know, they were propagated literally, 3 days ago,
Yeah.
on Monday. So I don't know necessarily that everyone is aware of this. I think parents are probably finding out about this. I think the questions are certainly going to start increasing, and we're going to see that. But I can tell you, there've always been these questions, and that's not unusual. I think we're just going to see an increased volume of these questions, and we respect parents. They should have questions. We need to explain why these vaccines are needed, and what the downsides are and what the big upsides are. And I usually try to explain to them that there's a lot of effort that's gone into this very rigorous science, and no vaccine is approved until there's very good evidence that it is safe. Now, parents ask about certain things like, well, I've seen my child, for example, after influenza getting the flu. Well, it depends on the type of vaccine, but we know that the influenza vaccine, for example, is a killed virus vaccine. It cannot actually cause the disease. Now,
Right.
children, and everyone's different, can have some reactions to vaccines. We know this. They can get some pain at the site of the injection site. They can get some redness, maybe a little bit of swelling. They may, not commonly, but they can get some fever. They may get some irritability, depending on the age. And that's sort of to be expected. But on the other side, if they don't get these vaccines and they get the actual infections and the diseases related to that, they can get extremely sick. So the purpose, and that's the message I try to get across for concerned parents, is that the purpose is really to prevent children from having to be admitted to the hospital, God forbid, go into the ICU because they're extremely sick, or in the worst case scenario, die. And unfortunately, we can go through the list of diseases that are vaccine preventable. And unfortunately, each year we are seeing deaths. And we can
Yeah.
go into what we're seeing with measles now and whooping cough and other diseases that we're seeing emerging because of what you describe as vaccine hesitancy. But certainly the vaccine rates are going down. We know that's been happening. We're tracking that. In Connecticut, the vaccine rates are actually very good. In fact, for measles, we had the highest rate in the country. But
Really?
already what we're hearing, that is correct. But what we're hearing now is that those rates are going to come down. So I think the statistics and the numbers for vaccine rates next year are not going to be as good. We know that they're going to come down.
And without getting too much science, we know you need to have vaccine rates at a certain level to keep disease at zero or eradicated, like we once had for a while with the measles. And now we're seeing a lot more cases. We're seeing more people decide not to vaccinate for whatever reason. And we're seeing some of these diseases, like measles. I've heard we're even seeing cases of polio again. Is that true?
Yeah, so each disease is a little bit different, and it's hard to generalize about all of them. So if you're to ask me, first of all, about measles, yes, there's a certain level of vaccination rates in the community that you need for that community protection. We call it herd immunity, but generally it's called community protection. And that's generally true for all vaccines. It's very, very, very well studied for some. And we know from measles, as you said, we need 95% of people to be vaccinated because numbers below that or percentages below that are more likely to lead to breakthrough infections. And so, we want that as a whole in a community or in a state or in a country, but there are pockets. So if you've got a pocket of a community where the rates are lower, that community, that specific community, wherever it happens to be, and however small or big it is, those children are huge risks for developing those diseases. And again, if you look at whooping cough, you're right. That's the other name for whooping cough is pertussis. We're seeing in different parts of the country where the rates are lower, vaccination rates are lower, that we're seeing far greater rates of whooping cough. And that can be
Yeah.
very serious. There were 3
Yeah.
deaths recently from whooping cough in the south of the US.
Yes.
In terms of the others, you can mention any of these infections. I'm happy to explain whatever, questions you may have.
Yeah, let's start with your mom. You're walking into the pediatrician's office, you're hearing some news, and you're wondering what's changed. So, can you explain exactly what's changed, which ones the CDC is no longer recommending, and perhaps what you might instead hear from your pediatrician who might be following the American Academy of Pediatric advice?
Correct. So, there's a long list, so I can certainly go through some of them.
Yeah.
But I think for parents interested, you could really go online and you could probably see summaries of these. But I'll tell you what has not changed.
Okay.
And this is important to recognize that there's still 11 different vaccines that we are recommending, the CDC recommends today, after the change in the schedule, that are exactly the same as they were before. And why? Because it's very, very well recognized, not only in the US, but across the world, that these are highly effective, they're safe, and they're needed. And that includes things that, whooping cough is the one,
Mm-hmm.
tetanus, diphtheria, so that's a combination vaccine. And these come in different combinations. The other one is Haemophilus influenza, which can cause meningitis and pneumonia. There's the pneumococcal one, which causes pneumonia and meningitis. There's the polio vaccine, which you mentioned as well, but that's really important that we don't allow that to come back into this country. It's a little bit more complicated that because people can import that from areas where they use a different type of vaccine, which is still a live type. It's a weakened viral vaccine, but it can circulate. So when people bring that into the US, there can be some isolated cases, but that's not failure of vaccination here. That's a different
Okay.
problem. And then there's measles, mumps and rubella. So even though there's been a lot of discussion about measles, that's still a recommended vaccine. That has not changed. Similarly,
Right.
varicella, which is the chickenpox vaccine, and the last one is the human papillomavirus, which causes warts in the genital area, and that can lead to cancer. So that's a lot of vaccines that still are recognized as being incredibly important. That has not changed.
Yeah, and let's just go back. When you hear measles, you might also know it as the MMR vaccine, which years ago, and maybe still in some circles, there was a lot of fear that it was linked to autism by some very faulty research. So I thought it was interesting because I know that there's been a lot of push to say that even the years ago when someone tried to, when there was a doctor who tried to show studies and links and it ended up showing false research and apologizing even for some of those studies that got people afraid of the MMR vaccine. As much as we hear that this new head of Health and Human Services Secretary, Robert F. Kennedy Jr., might be vaccine hesitant or wanted to shake up some of the vaccine recommendations, the MMR vaccine, which maybe is one of the most talked about by everyday moms, is absolutely still on that list. So there's no question, no one is saying
100%.
not to get that. So the people who are not
That is
vaccinating
correct.
for measles, do you think it's disinformation? Do you think it's something else? But even now with the new guidelines, it's still recommended.
You said it. I mean, it is absolutely still recommended. That has not changed. And, for people who are concerned and are hesitant for whatever reason, people have different reasons. I don't think that we should try and paint them with one brushstroke.
Yeah.
Everyone has different reasons. They're concerned about the just simple complications from the vaccine. They may be concerned about contents. There's been a lot of discussion about various additives to vaccines that people think they may accumulate and cause damage to children. That has not been proven. These are live viral vaccines, the MMR, so they may be concerned about that. But again, any of these concerns can be discussed and explained, and there's good science to really should make parents feel more confident that these are really safe vaccines. Now, having said that, I've already discussed some of the minor complications, but
Okay.
it's not unheard of that there can be more serious complications. And what's important to understand is that there's continuous monitoring in a very systematic way that doctors and parents and families can report any type of adverse reaction. They're monitoring this. And at a global scale, they're looking to see if there are any patterns for severe disease. And when vaccines in the past have been found to have some complications that are more severe, that's been picked up. A very good example of that is the rotavirus vaccine. The very first type of vaccine that was first approved and used widely landed up causing very, very extremely rare complication. One complication in a million children. I'm not sure of that exact number, but you can understand in a very large number of children who get the vaccine, it could cause a bowel obstruction, and that vaccine was removed from the market. Now there are
Okay.
others that have been found to be safe, but there's constant monitoring, and this is an ongoing process to make sure that vaccines are safe.
Before we move on to some of the ones that are now just something you discuss with your doctor, and maybe the CDC, the doctor may recommend it, but the CDC may say you don't need this unless you're high risk. Let me just ask you, to get your kids in school in Connecticut or to be a part of what we understand, has anything changed in that department, or is it all the same vaccines? Is there anything changing for school requirements right now?
So that's a great question. And I'm not really, my job is not in that area to give
Yeah.
you the most up-to-date information, but I do participate in a committee with the Health Commissioner of Connecticut. There's a group of specialists, both pediatric and adult infectious disease and general pediatricians and a whole range of people that are considering these issues, in an ongoing way. But because this is such a new announcement, I've not heard any change yet, but that doesn't
Okay.
mean that's not in the works. And I think that's the question for the Department of Health
Yes.
and the state government to find out what exactly is going to happen.
I do know when I've spoken to state officials, they said, and you're right, this has just come out in the last 72 hours or so. There's some effort to try to come up perhaps with a regional council of maybe New York, Connecticut, New Jersey. What are we going to recommend together? Because obviously, what Connecticut does, if we do something different than New York, we're all so closely connected. So I would imagine since it's just come out, unless something completely different, I don't know what our state policy says, and we'll have to look into that as we explore this tonight and tomorrow. And these, but if it's following CDC guidance, if that's what the verbal words are, then perhaps that, or written words, that's perhaps could create some changes. Or if it's in Connecticut, here's our policy. So I guess we'll have to see among the policy makers if any writing is going to have to change. I know nothing really matters till the next school year anyway. If you're a mom,
Right.
you've already gotten all the notifications. Have you turned in your physical? Have you done all these things? So I just know parents might be a little confused. I did speak to a local pediatrician at West Hartford Pediatrics, and he told me he's having a lot of conversations and that he's telling his patients to stick to the same vaccine schedule that he recommended 3 months ago, 2 years ago. He is sticking with the American Academy of Pediatrics. Is that how you're handling things at Connecticut Children's also for the most part?
Yes, for the most part, we are following the American Academy of Pediatrics recommendations. That's what I believe is the right thing to do. I think it's based on science. As I said, the science hasn't changed, the complications haven't changed, the effectiveness hasn't changed. It's just the interpretation, which the CDC is recommending. But from the medical community side, absolutely, I would agree with that pediatrician, and I think that's really the right way to go. Now, has Connecticut Children's come up with an official policy? We're talking about this right now. I mean, everything is changing. We're in the works. And we are providing the information to pediatricians. We're in the works of sending out that information to provide resources to look at the AAP guidelines and what the general recommendations have been, and that we feel that should continue. But I think what's confusing, and then we're going to see more and more of this, as you said, is there's going to be a patchwork of recommendations around the country because different states are going to have different regulations and different requirements for school entry and their own recommendations about what they expect to be done. So I do think parents are going to find and face confusing messages. And at the end of the day, there needs to be discussion with the provider because the provider knows best about their child. And if there are no risk factors, specific risk factors, my approach would be to do what we've always done because we know that's effective and we know it's safe.
Okay, and we only have a couple minutes left, but I just want to go over some of the other vaccines that are now no longer mandatory or officially recommended by the CDC. Our regard to the CDC believes it would depend if that child was high risk. Things like hepatitis, right? Could you tell us a couple that have changed?
Yeah, so you just mentioned one. One is hepatitis B. There's a lot of discussion about that because of risk factors to newborns. What hasn't changed if the mother is already tested positive for that, or if their status is unknown, that the child should absolutely get the vaccine. And not only that, but also get another type of medication, immunoglobulin, to protect them. And that's where there's a lot of debate. And they've decided that this should only be for high risk, and there are reasons why that may not be good enough because our testing system is not perfect. 18% of pregnant women do not get tested, and sometimes they get tested, but the results don't make it back in time to inform the care. The other one is for meningitis, which is called meningococcal. There's different types of vaccines for that. And another one is hepatitis A. Now, the thinking has been, well, these are not very common diseases. So, why do you need to get these vaccines unless either you've got a high risk or you decide that your child should get that just to protect them. So there's some overlap in the recommendations from the CDC. Those who are at high risk need special consideration, but anyone can get any vaccine. And that's why all the others, and those included that we've just discussed, if after a discussion, parents and the provider decide that this is the right thing for the child, then anyone can get it. It's going to be covered. It's going to be paid for by Medicaid, by Vaccine for Children program, and by CHIP, which is another insurance program. So they're all going to be covered, but it really boils down to boosting the confidence of parents to think that they're safe and effective so that they do request them or give permission for their children to get vaccinated. And that's where the rub is, that the recommendations, in my view, sort of start eroding that confidence. They're saying, well, not everyone should get it because there's some concern about maybe safety, and therefore you've got to think very carefully before you let your child get this vaccine. And in my opinion, that there's no science to really support that opinion, that these have been shown to be safe, and therefore anybody and everybody, according to the old schedule, should be getting them. So that's where the change is. But it doesn't mean that if you want to get the vaccines that you cannot. You absolutely can get all the same vaccines that you could have got before.
Very important point, Doctor. They will still be paid for by insurance and even on Medicaid and Husky. So, Dr. Ian Michelot, thank you so much for being here with Connecticut Children's and clarifying the Connecticut response to the new CDC vaccine recommendations. We appreciate you sharing your time with us.
Thank you so much. I really appreciate the time.
Absolutely. And for everyone at home, I will be bringing you new information on this on Eyewitness News at 4. For now, I'd like you to stay tuned because we're also going to bring you live coverage of a news conference in New Haven coming up, where we're expecting officials like the mayor and the acting police chief to give us the very latest information on the latest corruption investigation with the former chief accused of stealing from the Confidential Informants Fund. So thank you for being with us on the stream. You can find all of this on WFSB Plus if you want to go back and watch my complete interview with Connecticut Children's. In the meantime, stay tuned. We'll be back with you live in just a moment.